recent break-in at this clinic after midnight on the 10th of January has left this community reeling. According to police, 2 security personnel were assaulted, tied up, and had their personal belongings stolen. 2 nurses were abducted and taken to a nearby bush where they were assaulted and raped. The facility was one of 8 clinics in the area that rendered 24-hour services. The break-in has led to its closure as the department assesses the mental state of its workers. Locals now have to seek treatment at neighboring villages during the day and at the Lebowakgomo hospital at night. The community of Veerbom, over 100 kilometers from Ga-Chuene, is suffering the consequence of a similar break-in that occurred 8 years ago. During the attack, a home-based caregiver was shot and injured, a security officer was severely assaulted, and a nurse's vehicle was stolen. The clinic has since stopped offering overnight services, leaving the Elim Hospital as the community's only health facility at night.
They start to work at 8 o'clock and they close at 4 o'clock, so it becomes more problem to our people because they have to go to another clinic, which it is very far and it is costly because they have to get a transport and there is lack of transport due to a bad road.
It's not good for the people of this community and surrounding areas of this clinic.
Why?
It is because of there's no safety in our society. It affects us in a bad way because we don't have a place to get help when we need help.
At least one resident believes deploying police to clinics that offer overnight services would make them safer.
They can bring maybe a policeman, one of the policemen to come in, assist the security, so that even the nurse, they will feel that they are more protected, and the government will, they will see even the government is doing something for them to make sure that they bring good health care to the people.
The Limpopo Health Department has instituted an investigation into the Ga-Chuene incident to see if there were any security breaches. The Association of Private Security Owners of South Africa, however, believes government intends to use security companies as a scapegoat for deeper challenges that come with rendering 24-hour clinic services in rural areas.
The lowest bidder principle that is used by the department sometimes leads to inefficiencies on deployment of competent security officers or technology, as some companies tend to cut corners on certain essential security requirements in line with the scope of work simply because they have inadequate resources. Some security companies are not even paid on time by these departments, which most of the time has an effect on their operations.
Nurses Union Dinosa believes reinstating municipal security units to guard government property would lead to a reduction in crime.
We used to have the municipal security even in the past, guarding facilities of government. But we need control of the security so that they are properly trained on how do they ensure that health facilities, they are under the control of health department, including any other building of government must be under the control.
Public sector union NAPSO advocates for the installation of surveillance cameras at clinics.
We need to ensure that we have security who are having guns, not security who are just there in numbers. They must be equal to the task. Number 2, we want cameras to be installed in all facilities which are doing 24 hours. They must as well go to the university and go and make an investigation through that institution to say what type of security measures can be instituted so that we can have a safe environment, so that we can do 24 hours.
The department says it is committed to rolling out 24-hour services across the province. It says over 200 of 500 clinics currently offer the service.
If you look at our province, a rural province, you've got poor people who can't always afford to take themselves to hospitals. Hospitals by nature serves a huge part of an area. So you might find that people who stay far away from the hospital, when they've got health challenges at night, for them to be able to access a hospital might be a problem. But if they are staying next to a clinic that operates at night, they can either call an ambulance, or if it does not warrant an ambulance, they can even use a wheelbarrow to take their patient to the nearest facility. So what we're saying is that clinics are more closer to communities. Hence, we need to work very hard as a department, or we intend to work very hard as a department to ensure that they operate optimally.
A 27-year-old man has been arrested in connection with the Ga-Chuene clinic break-in. Biman Baloyi, SABC News, fear bomb outside Vuan in Limpopo.